Okay, just to finish up, whole blood is another component that can be given in terms of a blood product. It comes in bags that are 50 mLs per unit. The purpose of it is to provide volume replacement and to increase oxygenation. Whole blood is usually only given with greater than 25% blood loss, so you tend to see this more in trauma units and in places where patients have had significant blood loss with huge surgeries. Main nursing implications are going to be really the same kinds of things that you're going to watch for in terms of preparing and giving a packed red blood cell transfusion. You're going to do it exactly the same way with whole blood. You're just going to monitor it in the very same method as well. Platelets, again, these are your thrombocytes. They come in 50 to 70 mLs per unit, so a fairly small bag. They can be pooled, so you can have, what that means is they can be from a single donor, or you can take platelets from like donors and mix them all together. So you may hear them say a pool of platelets. That just means it comes from more than one donor. The purpose of platelets is to treat patients with thrombocytopenia that you guys will hear a little bit more about in the next lecture. They're usually reserved to be given when the platelet count is less than 20,000, which is very low, and they can be given when the platelet count is less than 80 if the patients are having active bleeding. Nursing implications for platelets: you want to try to give each pool of platelets or each donor pool as quickly as possible, over 15 to 30 minutes. You're still doing the same documentation and monitoring as you do for packed red blood cells. It's just going to be a much shorter period of time, and because of that you really kind of watch people very closely. And you don't use the standard transfusion sets because those filters will trap platelets. They need to have kind of a smaller filter and shorter tubing for administration. Fresh frozen plasma is another blood component that can be given. It comes in 200 to 250 mLs per unit or per bag. They can be frozen to preserve the clotting factors that are included within the plasma, and they do require ABO compatibility, meaning that a type and cross is necessary for them as well. The purpose is to administer for clotting factors. For some of the patients that would have clotting disorders, this would be important, or for protein status or fluid volume as well. If they were bleeding, sometimes these are given to increase the volume. Nursing implications: you want to, again, just like with platelets, these are administered in 15 to 30 minutes, but now here you're talking about a larger bag of fluid, so just realizing that that rate's got to be fairly quick to get that much volume in within 30 minutes. And documentation and monitoring, again, is the same as you do for packed red blood cells in terms of the vital signs, but sometimes it doesn't go on as long just because it's shorter time period. Cryoprecipitate is another blood product. It comes in smaller units of 10 to 20 mLs per unit. It's derived from plasma and is usually given for an individualized dosage, and it can be given IV push within 3 minutes, so it's very short administration. The purpose of it is for patients with hemophilia 8, von Willebrand's, and when patients have fibrinogen levels that are less than 100. Nursing implications for cryoprecipitate is, again, administer quickly, 15 to 30 minutes, and again documenting the same way that you would for all blood transfusions. Albumin is another blood component. It is the most abundant plasma protein that is found in the bloodstream. It can be used as plasma expander. In other words, to kind of as an adjunct when you're giving large volume replacements to patients who are severely dehydrated. It kind of helps to expand that volume further and to kind of help with some of the hypovolemia problems that a person might be having. Nursing implications. When you're storing this, it has to be kept in a certain area. It also has to be vented whenever it is administered. So when the vial is connected to an actual IV tubing and administered, it has to have a tubing that has a specific type of vent at the top that you open up to allow it to drip. In terms of transfusion reactions, there's a few different types, and you need to be familiar with these. Make sure that you really study over these and look at the definitions in the book, because you are going to have to, at least for this component of the testing part of this, you're going to need to be able to pick out symptoms related to hemolytic transfusion reactions and the other types that we're going to discuss. But hemolytic transfusion reactions is one type. The key symptoms that you would see with this is low back pain, hypotension, tachypnea or fast breathing, tachycardia, fast heart rate. The patient may appear very apprehensive and anxiety-ridden. They often may have a fever and chills and chest pain. And the interesting thing to see with hemolytic transfusion reactions is that the onset is immediate. So again, this is really a true reaction to, improper blood type given to somebody. And so when you see, say that you need to stay with the patient in the first 30 minutes, this is because if it's this really severe type of hemolytic reaction, you're going to see it easily really early on. And when you see this type of reaction, it is a medical emergency. You are going to stop the transfusion, notify the physician. You are not going to flush any saline through the tubing or anything. You're going to just take that blood tubing and saline connected together completely down and put a brand new bag and tubing up of just usually some plain normal saline and run that at a slow rate. Other things that are required is the first time they void. After that, you have to obtain a urine specimen. Sometimes they may have a need for diuretics to be administered. And you have to save the bag that the blood was in and the IV tubing to be sent to the lab. Another type of reaction that someone can have is an allergic reaction. And this type of reaction usually will look more like typical hives, itching. Sometimes they'll have facial flushing, sometimes shortness of breath or bronchospasm, and it really is a complete, not a reaction to the blood type as much as just an allergic reaction to some of the components. If patients have had this kind of a symptom before, sometimes the doctor will pre-treat the patient with Benadryl IV if they've had that type of history. But irregardless, if they should have these symptoms, you stop the transfusion until the type of reaction is determined. So again, this is one where you're going to stop the transfusion, notify the physician, and then treat the symptoms. It may be post-treatment with some Benadryl after the fact because it wasn't recognized that the person was at risk and the person may not have been pre-treated. A third type of transfusion reaction is just a plain old febrile reaction. This kind of reaction, the patient will have chills, fever, headache, flushing, some muscle stiffness, pain, sometimes increased activity, but you don't tend to see the back pain that is with a true transfusion reaction in terms of a hemolytic. And what this is caused from is that there is antibodies maybe in the donated blood that don't kind of match up immunity-wise with the person who's the receiving person of the blood. And so because of that, if it's known that people tend to have the more and more blood transfusions you have, the more antibodies that you as an oncological patient are exposed to. So one way to deal with this kind of potential reaction is, of course, you can premeditate some Tylenol, but another way is to make sure that you use leukocyte pour or frozen washed pack cells, and to make sure that the patient is kept warm and covered during the transfusion. But these types of two different kinds of blood preparations kind of cut down on the amount of antibodies that would be in the blood that the person would react to, and thus reducing down them having the febrile reaction to it. Hopefully this gives you a good idea about some of the nuances. It's not everything that you need to know in terms of how to administer a blood transfusion, but this will give you some of the basic skills that you would need to know.